Welcome to Wellness with John. I'm John Peters, a therapist who's been in practice for 25 years. This channel is my opportunity to share a variety of resources with you to help you thrive. And in this video, I'm going to be offering a guided body scan, which I will explain after the intro here, but it's something that you can practice in order to get some diffusion in your awareness of your body, especially to deal with chronic pain. Okay, so welcome to this video. In this video, I'm going to talk about the body scan, and then I'm going to lead you through the body scan. So if you want to use this video in the future to go through the body scan, I'll put a chapter tag right at the beginning of the point where the guided body scan begins. So if you come back to this video again later and you want to skip this introductory explanation part, you can just jump right to that point where the body scan starts and then do it that way. But I wanted to offer some introductory explanation so that you understand what it is and how to use it. Okay. So a body scan is kind of like a guided meditation, but our goal is not really relaxation. Our goal is not really to enter any particular state of mind. What we are aiming for is just an open awareness of the body. And we do this by relaxing, relatively in a comfortable position. You can do it sitting down, but if you're comfortable doing it lying down, the ideal setting would be lying down in a comfortable position in a room with very little or no distractions and the lights turned down and your eyes closed so that you can pay attention optimally to what you notice about your awareness of your body during the body scan. Okay, so relaxation is not exactly the goal, although people often do feel more relaxed when they do a body scan. So basically, you lie down, you close your eyes in a room with the lights down and no distractions. And this body scan that I lead you through in this video is about 17 minutes long. So you need to have 17 minutes or so in order to do it. And what you're going to do is just follow my instructions as I lead you through them in the body scan, and in turn, pay attention to different parts of the body. Now, the reason that this is a useful technique, especially if you have discomfort or pain in your body, is that our brains get highly focused on and locked into pain signals. And the way our brain works and the process of what's called nociception, so the entire apparatus of our nervous system, our tissue, our brain tissue, everything working together to create the experience of unpleasant stimuli, including pain, that can result in the brain increasing the focus on the part of the body where the pain exists and basically occluding, putting on blinders to the rest of the body. And obviously that is a recipe for more misery than we need, because now we're having a greater experience of the pain, not just pain in the context of everything else we can experience in our body, but the pain signal itself has been magnified and the other information has been reduced. So the logic of doing the body scan is that you take a few minutes, you are going to relax the mind, try to be in a neutral, non-judgmental, open awareness, and you're going to, following the instructions in the guided part, you're going to place your attention on different parts of the body in turn, and eventually you will have scanned all of the parts of your body. And if you get distracted, just come back to it, okay? Distraction is normal. If there's a part of the body that you're trying to kind of tune into and you don't feel like you have a real rich sense of that part of the body, that's okay too. Sometimes we tune into, like I could tune into my elbow and, oh yeah, I really can feel that elbow, what my elbow feels like, but maybe not, right? So just go with what is, because the state of mind that we try to be in with the body scan is, I'm going to be with what is, not what I think should be. Okay. I'm going to take a moment to ignore everything else in my universe, and I'm going to pay attention to that part of my body before I move on to the next part of my body. So I would recommend that you try this out, and you might try incorporating it into your lifestyle, perhaps doing it 1, 2, 3 times every week. You can do it daily if you want. There are no real side effects and no cost beyond the time that you spend doing it. But try it out and see how it works for you. Feel free to leave comments below. And be aware that this body scan that I'm sharing with you now, it's a component of a program that I use when working with people who are suffering from chronic pain. And I'll put links in the description below. But if you'd like to look at my private practice site to consider whether you might want to work with me as a coach to help you with chronic pain, there'll be a link there. And if you would like to get a free additional video that goes into depth explaining how the stress response and chronic pain interact to create the misery of chronic pain, and why mindfulness techniques are actually really good to ameliorate chronic pain, I'll put a link down there. You can click to the free chronic pain video and get access to that as well. And just be aware, if you access that video, it does add you to my newsletter mailing list, where I send out free wellness tips every once in a while. But you're welcome to unsubscribe at any time if you'd like to do so. But if you want the free chronic pain video where I talk about how mindfulness helps with chronic pain, and it gives you additional resources too, like my curated chronic pain video list of some things that I found around YouTube. There's a private list, and you get that if you sign up for that as well. So I'm going to be quiet now and transition this video into the body scan. But what I'd like you to do is find a comfortable place to sit or lie down, turn the lights down, close your eyes, and then pause the video, while you're doing that. And then you can hit play, and I'll put, again, the chapter tag so that you can skip right to that part if you want to skip to the body scan either now or when you come back to listen to this video in the future. All right, thanks for joining me today. Okay, so I would like for you to settle into your position and be relatively comfortable, sitting or lying down with your eyes closed. And during this exercise, you may feel varying degrees of relaxation, but we're going to pay attention to the body. And while you may progressively relax, we're going to notice the degree of relaxation or tension in various body parts, rather than trying to make the experience be any particular way. So during this exercise, you're going to have open awareness, a curiosity about what you experience when you focus on various body parts. Feel very free during the exercise if you want to shift your position. You don't have to stay totally still. If you want to squirm around or change your position, that's totally fine. Our primary focus will be maintaining awareness of the body. You can begin by focusing on the breath. When you notice your breath, you might notice that it is not as even as you sometimes assume that it is, but that's all right. Just notice the parts of your body that are moving when you breathe. You might also notice the sensation of air going in and out of your nose or your mouth. So just tune into the breath as your body is naturally breathing. You're noticing the movement. You're noticing the physical feelings of the breath. And you're noticing the sensation of the air. You can also notice that gravity is gently holding you in the position that you have chosen. And you can feel the parts of your body that are touching the bed or the chair or the couch. Parts of your body have some gentle pressure on those surfaces. Now, I would like for you to shift your attention to your right foot. You don't have to do anything special with your foot, although you can move it around a little bit if you want to. But I'd like for you, with each breath, to imagine that you're breathing in your foot. Just notice what your foot feels like. And notice your right ankle. If you put your mind into your right ankle, you might be able to have a sense of your ankle. Maybe there's not much information coming from your ankle if you don't have pain there or can't feel something strongly. But just tune in to what you notice when you place your attention on your right ankle. And next, I'd like for you to pay attention to your right calf. What do you notice when you pay attention to your right calf? And then move your attention to your right knee and on to the upper right leg, from your knee all the way up to your right hip. How does your leg feel? Next, I would like you to go to your left foot and check in with your left foot. And what can you notice when you place your mental awareness on your left foot? And then scan your left ankle. How does your left ankle feel? If distractions happen, you hear a sound, you think of something, that's all right. Just gently bring your mental awareness back to your body. And next, pay attention to your left calf. And as you continue to breathe in a relaxed way, you can then shift your attention to your left knee, on to your left upper leg, all the way up to your left hip. What do you notice when you pay attention to your left upper leg? With some body parts, you may not notice much. With some, you may notice something that you weren't paying attention to before you placed your focus there. Next, shift your attention to your pelvis, to your lower pelvis region. You might feel the motion of the breath in a subtle way in your pelvis each time you breathe. But what can you notice when you pay attention to your pelvis? Then move your attention up to your lower belly. Your lower belly is moving with each breath. You have sensation with the abdominal muscles, but you can also feel into the core of your body in your lower belly. Then you move into your chest. Pay attention to your chest as you breathe. You may notice your heartbeat. What sensations can you notice in your chest? Move your attention to your right shoulder. As you breathe, you may notice subtle movements in your right shoulder. Are there sensations there? And slowly move your attention down your right arm to include your entire arm. And then focus your attention on your right hand. We have a lot of nerve input from our hands. When you place your attention in your right hand, notice what sensations you feel there. Then move your attention up to your left shoulder. What do you notice about your left shoulder? And as you continue to breathe, move your attention down your left arm to include your entire left arm. And allow your attention to be aware of your left arm altogether. Then focus your attention on your left hand. You may not be moving your left hand, but you can feel the feelings in your left hand. Breathe into your left hand. Now bring your attention back up to your shoulders. Pay attention to your shoulder area altogether. As you breathe, what do you notice about your shoulders? Move into your neck. You may or may not notice movement in the neck area when you breathe, but you can notice what you notice when you pay attention to your neck, leading up to the base of your skull. Now bring your attention to your cheeks and your lips and your teeth. And notice again the sensation of the air going in and out of your nose or your mouth. And then feel your eyes. Pay attention to the feelings in your eyelids and your eye area. This leads us up to your forehead. Pay attention to your forehead area. Pay attention to your entire inner skull area. You may notice emotional information when you're paying attention to your head. When you bring your attention to the middle of your head, or you may have random thoughts pop up. Just notice them, let go. And pay attention to the physical sensation of your head. Then move your attention up to the top of your head. Pay attention to your scalp. As you breathe, you're paying attention to the top of your head. Now bring your attention out. Zoom out so that you actually include your entire body. Feel the entire surface of your skin, from the bottom soles of your feet, up your legs, through the core of your body, through your shoulders, including both of your arms, your neck, your face, all of your head. As you breathe in, feel your entire body fill slightly. As you breathe out, your entire body may empty slightly. You're breathing into the entire body all at once. And you can notice sensations over your skin across the area of your entire body. Feel free to take another minute to just relax into your current position and continue to breathe into your entire body. And part of what you can notice is that you can have awareness of parts of your body that are free from physical pain. And you might choose to return your awareness to one part of your body that does not have physical pain and breathe into that part. Bring your awareness back to that part. As you continue to relax and breathe, just place your awareness in that particular part of your body. And when you're ready, you can open your eyes and end this session of the body scan.